Hi, my name is Sanchit. I'm one of the fifth year medical students at UCL and currently a research intern at the tech group Queen's Square. So one of the projects I'm currently involved in is non-critical symptoms that patients report after surgery. For example, a lot of patients are often consented about major complications which can happen after neurosurgery, such as seizures or CSF leaks, major neurological deficits. However, those complications are fortunately quite rare, but what's a lot more common is things like hearing weird sounds after surgery or having weird sensations on the scalp, things like that. And those type of non-critical symptoms are quite understudied in the literature. So what we're doing is running a survey where we're investigating these types of non-critical symptoms so that we can better document them, better understand how they impact patients, and then accordingly change our approaches to when we're consenting patients and so that patients are more informed about what to expect. There are some studies which investigate especially the sounds, the different types of sounds, the popping, the crackling, the clicking, the buzzing, static sounds. So all these different types of sounds have been studied, but I think overall just non-critical symptoms in general, they're quite understudied. And there's definitely not much about the incidence of them or the impact analysis of how patients actually say that this is impacting my life. So we're actually running this project as a two-stage survey. In the first stage, we called patients just before their first post-op clinic appointment, and we asked them questions in a way which made it more intuitive to them, asking about the five senses. So asking if they've experienced any changes relating to their eyes, their ears, their nose, their mouth, or then touch and around the scalp, and asking about any minor changes, things that they've noticed out of the ordinary related to the five senses. And through that, we built a comprehensive list of all the symptoms that patients reported. The main aim of the project is to better inform patients of what to expect post-operatively. So whether that means making some patient information videos which they can be shown which have all these symptoms listed out, whether it's updating the leaflets, which don't currently mention these non-critical symptoms as much, and just having it as a catalogue even for the doctors who are consenting the patients in the clinics pre-op, so that they know that here's a list of symptoms that 50% of patients experience. So just so that patients are better informed and they know what they're getting into when they're agreeing to surgery. I think when we're doing research, it can be quite easy to just keep looking at technological advancements and trying to advance surgery as much as possible. But at the end of the day, the focus is always on the patient. It's always about what's actually making the outcomes better for the patients, what's making their experience better overall. And I think that's why something like this is so important. It's actually asking patients, what are you experiencing after your operations which is bothering you? Because sometimes something which is quite trivial from the doctor's point of view can be impacting a patient quite a lot. So in a nutshell, this study is all about what matters most to patients, understanding their priorities, their viewpoints on these surgical procedures. And accordingly, that's what should matter most to researchers as well, going forward and designing further studies.